having diabetes. Type 1 diabetes is a condition that a lot of people in India do live with. And while I am not someone who can speak much on this topic, what I can tell you is that we have been in the room with people who have this condition, who have lived through it, and who are doing extremely well in life. This is a condition which affects a lot of people in India, and it is something that is not spoken about because people look at it as a social stigma. People look at it as something that is very exclusive and not inclusive. They don't want to share their feelings and burdens. They tend to associate it with the same feeling you get when you talk about cancer or HIV, and that is something we should not be doing because this is manageable. This can be taken care of, and we only wanted to bring this awareness campaign. All the educators out here on today's call, where we wanted to showcase this as an opportunity for you as school administrators and as educators to bring this down to the grassroots level, to your school children, to the kids who are part of your school. Do we know how many school children we have in our own schools who are having diabetes? Are they managing it well? Are they able to cope up with the pressure of having this? Are they able to talk to somebody and let their soul out? These are all conditions, and these are all situations which we want to now soften with the aspect of our type 1 school, a type 1 diabetes school hackathon, which we will be launching. And the reason we wanted you over here on this call today was to tell you that while I4C is known for innovation in technology, we do a lot of fun stuff, we do a lot of crazy stuff, but this is something which is very, very close to our heart. And, we want to give it our all. We want to make sure that we can break through this stigma that people have, that this is something to not be spoken about. And we want it to be very, very inclusive. And for that, I have two of my lovely friends on the call with me who will be speaking later. One is Mridula and one is Jyotsna. And as you can see, these beautiful, healthy young girls are here who will tell you that this is something that can be defeated, this is something that can be managed. And at the same time, we want to showcase this to the children, the schools teachers. So we want you to know, yes, while we are running a hackathon campaign, there is going to be innovation. There's going to be a lot of prizes. There's going to be good amount of money because JDRF is an international company. They are sponsoring it. But there is a social angle to it. And for every one of you who takes part in this, I want to warmly say from the bottom of my heart that you'll be doing a great, great service to us. You'll be doing a great, great service to the country. And most importantly, to the children in your school who may have this condition, who are living with it. And that's something which is very, very important to us. We will be surprised at the end of this tenure of this hackathon of how many children we may have potentially brought out from their exclusiveness into our inclusiveness. So with this, I want to now hand it over to Saurabh, who will share a bit about the hackathon, and then we can take it forward from there. Once again, Jyotsna and Mridula, thank you for joining us.
Thank you, Deccan, for the invite. Thank
Yeah,
you.
Saurabh, over to you. Saurabh, you there?
Yeah,
Yeah,
thank you. Thank you, Ricky.
yeah, yeah.
So
I will step
now I
in for
will
the
walk.
problem statements. Sorry,
Yes,
I
sure.
will step in for the problem statements when you get there. Yeah, thanks.
Yeah, yeah. So this is our beautiful landing page of the Type 1 Diabetics Hackathon. Here you will get all the information regarding the hackathon and the project that we are running currently. Again, first we will go through the problem statements, then we will go through the registration process for the hackathon.
Correct. So we have taken a lot of inputs from JDRF and the communities, including Jyotsna, Mridula, and a couple of other friends, all over India, which talks about what are the kind of problem statements we wanted to bring out now in order for children to relate to. For example, they're very simple in the way they look, but very, very critical in the way we approach them. So there's going to be a lot of informative, throughput of communication which could happen between us and you, or maybe between you and your school children, so that you make them completely understand what it is. Also, this will be a good learning experience for a child to learn a little bit more about stuff which is not in his or her current syllabus. For example, how can I help my friend who has type 1 diabetes feel supported? That means feel inclusive when they require insulin or need to treat a hypo. A hypo, I also got to know, was when you have a low blood sugar situation, when you start crashing because you have very low blood sugar in your body, and helping them to participate in activities without feeling conscious or held back by the condition. Since we are in school, we like to play games. We have PT, physical education classes. There might be people who want to participate, but because of the fear of them feeling breathless, or the fear of them crashing, the fear of them not having a buddy who they can feel supportive around, this could lead them to not being part of intrinsic social activities while growing up. So this is a very, very important problem statement which talks about A, feeling supported, which is inclusiveness. Descriptive could be very simple. The challenge, we're looking for creative and empathetic solutions that promote awareness and provide support for individuals having type 1 diabetes while minimizing any potential stigma and empowering the friends with type 1 diabetes to take part in various events and activities while ensuring they feel comfortable, confident, and safe. Participants should consider the following aspects: educational initiatives, develop innovative ways to educate your friends and peers about type 1 diabetes, its symptoms, and the importance of the support that we give them. This could involve workshops, awareness campaigns, or engaging in educational materials. Now, over here, we may have school children who have type 1 diabetes who would be willing to share this information because they already have it, they live with it, they get up in the morning with it, they go to sleep with it. They are the best person today to tell us how we can control this situation if and when it comes, and what they as individuals look for in terms of support and empathy from the people around them. Second is communication strategies. Explore effective communication strategies that allow individuals with type 1 diabetes to express their needs discreetly and confidently to their friends and support network. This may include digital or physical signaling methods. So this is something that we could talk about because every person or kid in school, everybody has a gang, a secret gang with a secret sign. We encourage children to look at something, a way to create maybe a WhatsApp group, a messenger group, or some sort of group where there is easy access to get support if he or she needs it. Inclusive event planning. When planning events, consider the needs of your friends with type 1 diabetes. Ensure that there is easy access to water, space for blood sugar checks, and option for diabetes friendly snacks. Very, very important because when you're children, you're always on a sugar rush, and that's something which is a strict no-no for people with type 1 diabetes. So we need to make them more aware of, yes, we have a friend who has this condition, and we need to be a little more careful because he, being a kid, will obviously have the same expectations as you and I do, and he also would want to munch something which is equally delicious but may not have the idea of what the repercussions would be. So we need to be very careful and create a ecosystem of inclusiveness where he can feel safe knowing that the snacks available are safe for him to consume. And lastly, buddy system. Create a buddy system where friends with type 1 diabetes can attend events together, providing each other with support and encouragement. The goal is to create a supportive and inclusive environment where your friends with type 1 diabetes feel encouraged and confident to participate in school events and activities. Over here, I would like to say, and this is something that we have talked about. Um, when you look at schools today and even colleges, there is no situation as such where we have a center of excellence around diabetes management. There is no university which talks about wellness management, including diabetes. We have yoga, you have relaxation, you have naturopathy, you have tons of things. You'll even have Sadhguru having his 7 principles to lead a good life, but nothing focused on diabetes. And if your school or a group of schools could come up with this as part of a curriculum, not as part of a whole-time curriculum, but something part-time, something which could be where a student can opt for this course, it could add a lot of differentiator to the way we project ourselves towards this condition. So again, educators, this all depends on you and how large we want to make it. It can be as large as we want to make it. So that's what I had to say. Saurabh, you can take part two. You can take part two. It's a little more just very easy. You can talk about it.
Okay. The second problem statement that we have come up with is how we can make diabetics monitoring devices more attractive and appealing. So this problem statement has two parts. That is the first one, making the devices like pump and the monitoring devices more attractive and appealing. The second part is how we can make daily wear apparels like clothes, the clothes that we wear in schools or in functions or any way, any clothes to accessible to wear these devices like insulin pumps and glucometers. So students have to select one of these sub problem statement and work on that. So the descriptive is like we want participants to explore creative ways to improve aesthetics of diabetic devices. If you have ever seen a pump, it's kind of a black device or a white device, a simple device. So we want students to make it more attractive. They can come up with some nice designs. They can have some stickers on that, make it more appealing, and like they can like it should look like and more fun and like as like we have our mobile phones, we put on wallpapers. Student can come up with putting some wallpapers on that those devices which the type 1 diabetes uses. Students can think a way to make it easier and more fashionable for individuals with type 1 diabetes to wear their necessary devices like pumps and use and the glucose measure. The clothes that we wear every day don't have any pockets, especially for such devices to carry. So we want students to come up with such ways, like modified clothes. They can come up with to have a pocket or a section where they can put these devices. So the aspects which they can address in this problem statement like cool designs. Imagine a creative design that can make this device look exciting and easy to use. Think about some using fun colors, attractive, which are attractive for kids and teens. Then fashionable accessories. Design the clothes or accessories like belt, bracelet, phone cases with the built-in pockets or compartments to easily hold the diabetic devices. Then stylish pouches like wallets, then purse, like female users. So they can create some pocket around it or a small buckle around it and make it more stylish to carry the pump and the glucometer. Then personal touch, of course, they have to give some personal touch to it. Then this is most important, ask an opinion. So the kids can go to ask their type 1 diabetic friend and do the research around it and find out a ways to make this possible. So try it out. Like if they have any idea, try making models and drawings to show the devices could look cooler. So we don't want students to really come up with some. They have to go and buy some stuff. That they just have to put their idea on the paper and submit to us. Okay. Again, would like to take the third one.
Yeah, sure. So how can we help people be aware of the early signs and symptoms of type 1 diabetes? So yeah, so participants should consider in this challenge, we want students to think about ways to tell people about the symptoms of type 1 diabetes before someone actually gets diagnosed. Knowing these signs early can help save lives. So it's like an early warning system. Maybe we can have the students themselves come up with some poster competitions, some very nice way to communicate this within the schools, within their groups, within the communities, in the school itself. They don't even need to they don't even need to keep this within the school. I'm sure that the societies where they live in, the gardens where they play in, the classes where they have tuitions, they can also share this information because the information is worth sharing with everybody. It's not something that we need to keep only for the school. So the more the merrier. So creating posters, brochures, simple videos that explain the common symptoms of type 1 diabetes in easy to understand language. So, everybody has a nice phone nowadays. Kids can be encouraged to pull out their phones, make a nice video, which they can, share it with us, the link on YouTube, showcasing a little skit around what they'll do in terms of if a friend has a hypo or is undergoing some problem because of type 1 diabetes not being diagnosed early, what could be the repercussions, and what could they do to save him or her before the repercussions actually get serious. So maybe some preventive videos, some informative videos, some educational videos. Very, very nice to make. Organize campaigns in the school to teach your fellow students and your teachers about these symptoms. Maybe you can have a special day dedicated to diabetes awareness. So very, very important. I just want to give you an idea that we have World Diabetes Day coming on the 14th of November. That's 2 days after Diwali. So it's coinciding with Children's Day. So it's a wonderful day because we are dedicating this campaign to the kids, and it's also World Diabetes Day. We had World Mental Health Day yesterday. So we've had these wonderful days where we're talking about inclusiveness and emotional support between communities. We really want to see this get into actionable influencing from your side. Talk to your family about the symptoms and encourage them to share his knowledge with friends and relatives. Families are very, very important criteria in terms of diabetes management. Um, a lot of families themselves are clueless because, as my friends will say, sometimes it is not hereditary. It could happen genetics, but it may not happen because your dad has it or your mom has it. So sometimes even parents are clueless on how to support this, and then they go into a shell as well because they don't have anyone to talk to as well. These kind of campaigns which we run locally and, as I said, within our communities will make a big difference, not only for the child, also for the caretaker slash caregiver, and of course most importantly the teacher as well. So these are very, very critical things we should do. You should ask for stories. Sometimes personal stories can help people remember better. So ask if anyone has an experience with type 1 diabetes, whether they are themselves having the condition or whether they're themselves living with it, or do they know someone close to their heart who is living with it? And is there something that they did that helped prevent a bad day from happening? Or is it something that they did differently and that person is now well, hale and hearty? These are very, very important. Number 4, how can we design ways or resources for type 1 diabetes to support the diabetes management and store all the vital information like their insulin and blood glucose levels in an easy and accessible format? Um, so over here, before we go ahead, people living with type 1 diabetes, and they live with it, right? So they have to take care of themselves, self-care all the time, monitor their insulin, monitor their blood sugar. It's expensive to do, and it also takes time. It also takes a lot of discipline. So having an app to help you remember, having something available which could make it easier for you to do your things by rote, bringing it into your busy schedule, making it a task which can be rewarded, is something that we are looking for from the school children. That no more is it a chore, no more is it a dreaded task that I need to take my injection or I need to check my blood sugar. No, it should be something that can be rewarded for the child and also for the communities around him or her. So in this challenge, we want students to think of ways to support children and teenagers with T1D to do the important things to keep themselves healthy, like taking insulin and checking their blood glucose levels and finding a way to store safely all this vital information, because this is a day-to-day activity. You miss one day, you don't know what your levels were yesterday, you're gonna have a problem today. And my friends will talk about these things because they have experienced it in real life. Participants should consider the following aspects. So gaming and rewards. Can we turn this into a game like I discussed? Maybe earning points or badges, educational stories. Very important. Stories form a very important part of this campaign. Peer support from friends, family involvement, reminder analysis. So create a smartphone app or a feature that sends friendly reminders for taking insulin. wearable gadgets. Today, everybody wears a smartphone or has a smart watch or has a wearable goggles or whatever. So, can they use the technology to help them get through the day, give them reminders, help them live a healthy life on a day-to-day basis? And obviously, the use cases should be friendly. So, printable reports and user-friendly interface. The UI UX should be good. It should be easy to see as well. The goal is to help people with diabetes maintain an accurate record of all the consumption, which can be vital for effective diabetes management and healthcare provider consultation. So tomorrow, when they go to their doctor for a quarterly checkup, annual checkup, they have all the information at the tip of their fingers. So creative solutions are needed for this. And the last is, so we only came up with 5 over here because we didn't want to we didn't want people to go through the road because uh, we didn't want to have too many similar sounding problem statements. So we thought that these 4 are apt, they're easy to remember, they fulfill certain criteria. One of them wearing the right clothes with your devices hidden, creating a fashion statement because youngsters today are very fashionable. Second is, of course, addressing the issue of your information. Third is, of course, creating an ecosystem of inclusiveness. And fourth is early warning systems. The last one we thought about was we give somebody a chance to have an out of the box solution. Come up with whatever you want, whatever crazy idea you may feel, it's crazy. But we have no problem with that. When Zepto came out with 10-minute delivery, people thought that they were crazy. Today, Zepto is sitting at $1 billion valuation. So nothing is crazy anymore. Um, we want students and teachers to think out of the box over here. It could be anything. I have one suggestion. So I had one out of the box idea, and I'll do a little bit of cheating over here, where I thought about how do you keep insulin cold? Insulin needs to be at a certain temperature always before it can be consumed. It goes directly into your body, no? It has to be at a certain temperature for the body to accept it. Most poor people don't have fridges. Most people who are traveling don't have access to fridges. What do you do in certain situations where I don't have access to a refrigerator at that point of time? So can you come up with a solution to keep your insulin cold? So when I was small and I was in boarding school, yes, I was in boarding school, I used to keep my water bottles in the river. So when I wanted to drink cold water, I used to pull them out of the river. 1 second, Shreya, 1 second, 1 second. So I used to pull my water out of the river and the water became cold. So that is one off the mind solution I thought. And there's no good idea or bad idea. I just want something which is out of the box, crazy, but which can be delivered. You know, something which can be delivered, something which is friendly to the environment, something which is sustainable, and most importantly, which is not very, very expensive to actually replicate. Because if this is a go-to-market solution, then it'll be great. Okay, Shreyas, you have a question? Please ask.
Yeah, I did understand. Actually, I was thinking about vision. Question you said, the problem statement.
Haji?
Uh, can eat the insulin in cold water or river water. I thought of a second option that we can keep the insulin into the mud containers or the pots and then cover it with a wet cloth.
Yes, superb. So yeah, there's so many things we can do, right? Um, and I leave this to you and your teams to come up with something crazy. Nothing is crazy until it's done, right? So I leave that to you. That is why we kept an out of the box solution because we really wanted to see how wacky people can go. Because this is a awareness campaign which has a large emotional connect to us. We didn't want to go overboard with our problem statements, so we kept 4 very critical problem statements, but we kept one just in case there are children who want to explore the boundaries of creativity. So I wish you, Shreyas, all the very best. And you can reach out to me if you have any questions on a one-to-one. With this being said, I'll just uh, say my quiet, be quiet for some time and hand over to Ashlesha to take over, and then she can introduce our friends who have joined us as well.
Hello everyone, Shlesha here, and I'm a type 1 diabetic myself for the past 16 years. Just a sec, I'm presenting something. Yes. Is this visible to all?
Yes.
Yes, hello. So today I would be covering three topics about what is T1D. It's also called as type 1 diabetes. What are the early signs and symptoms and what are the treatments given? Okay, so let's start with what is T1D. T1D is also known as type 1 diabetes, and this type of diabetes is most prevalent in kids, teenagers, adolescent. Actually, there's a myth, and we all the time assume that diabetes is something that can only be diagnosed in the people with the age of say after 30s or 40s or 50s, but unfortunately that is not the case. There is a type of diabetes that is actually seen in kids, newborn babies, adolescent, teenagers. Let's get back to our basic anatomy. How do we our human body needs energy, right, to work, some kind of fuel to work properly. So when we eat anything or drink anything, be it a half cup of milk or a few strawberries, a half apple or anything, all of this gets converted into glucose. Glucose is nothing but the energy that our body uses to work and function properly. So there are cells called as beta cells in our pancreas which produce a hormone called insulin. So what this insulin does is it converts that glucose or that sugars, that carbs, everything into energy, and it provides this energy, or provides this energy and glucose to each and every cell of our body, right? So in type 1 diabetes, what happens is these beta cells either stops producing this hormone insulin completely, or what the amount that they produce is not sufficient for the human body to cover their needs, or keep the glucose level in the bloodstreams within the normal range. There are currently 8.6 lakhs of people living with type 1 diabetes in India, and this number is ever increasing. So, some of the early signs or symptoms of diabetes are frequent urination. A kid complains, or like has to go to bathroom. Like you can say, more than 2 times in an hour, or more than 3 times in an hour. They have to wake up at night to use the bathroom, or excessive thirst, nausea, fatigue, extreme weight gain or weight loss. Some of these are early signs or symptoms of diabetes. If you see any kid or any family member going through these, please suggest them to visit a doctor as soon as possible. Okay, so some of the common treatments that are given to treat diabetes is insulin. Okay, one of the most important treatment is insulin. So what people living with diabetes, they have to inject themselves with a certain dose of insulin uh, decided or prescribed by the doctor. It could be for 2 times a day, 3 times a day before every meal they eat. It completely depends on the person, their body, and what the doctor prescribes. Okay. Second most important thing that helps people, stay healthy or maintain their sugar levels is exercising and diet, and also getting their tests done regularly. Some of the modes of giving insulin are insulin pen. As you can see, there's a cartridge here, there's a small needle, and here's a small key where you can adjust the dose. Say if someone wants to take only 2 units or 4 units, or the doctor has prescribed them to take 10 units at a time. This is a very, portable and easy option, especially while you say like kids are in school or colleges or traveling anywhere, or people who go to office. This is one like most favorable mode of taking insulin. Another one is insulin pump. So this small device, as you can see here, it is attached uh, via a needle to a human body. It could be on their stomach, on their hands, on their thighs, or on their lower back. And here you can see the graph. This shows how much insulin has already been distributed. This figure here, 204, is the sugar level. And these small buttons are there to, help them adjust the dose and everything. And the last mode of taking insulin is syringe and a vial, as you can see here. Does anyone have any questions regarding this? You guys can type it. Hello. Okay, no worries. You guys can type it in the chat box, and if you feel comfortable, you guys can also come on camera and ask the questions itself. Okay. And I would, yes, thank you for joining us, Jyotsna and Mridula. Thank you so much for being here and supporting us. So, my first question is, why do you guys think it is important to address this issue at the primary level in schools with kids? Any one of you can come forward and answer the question.
Excuse me, can I?
Ashusha, can you repeat again? And I think there is a question from Mr. Anand. I think Mr. Anand, please go ahead.
Yeah. Thank you so much. Like as per Aslesh's analysis, like as of now, because of the heavy ride, what are the things we have been facing, like after the post-COVID especially. So we don't know even most of the youngsters, even adults, irrespective of the age. So everybody have been facing these issues. So as per the discussion, it's mandatory to go with this check because even you two don't know, me too don't know. If we don't know, like we don't know, like if we didn't went for a checkup. So after the checkup itself, we can analyze that and we can start up because we have seen one of my friends that he's feeling starving and what is it? His energy levels are just dropping like anything. But when we have started analyzing, he was in the first stage of the diabetic. So when we have analyzed it in the first itself, there is a lot of chance that we can get rid of that in the initial stage itself, so that advancement can be cut off in the initial stage itself. That's what my input is.
Thank you, Mr. Anand. So I want to clarify something over here. First, I'll introduce myself. Yeah, so my name is Mridula. I'm based in Delhi. I am a public health consultant and also a certified diabetes educator and patient advocate. And also, I have completed 31 years this month with type 1 diabetes. So, Mr. Anand, what you just mentioned, this is also something that we need to take care of. There are you'll be shocked to know that there are more than 40 plus types of diabetes, clinical diabetes, and you know, very thin line difference could be there in between each of these types. Now, according to the guidelines of screening for the people in our country, so above 30 is the guideline. So above 30 of age, people are screened for type 2 diabetes. Okay, mostly for I mean, we can say diabetes, but mostly it's above 30 they screen for type 2 diabetes. Now, even if someone is at pre-diabetes stage, which is slightly higher blood sugar levels than the normal range, which is mostly around 90 uh, before breakfast and 140 post meal. So this is kind of the target range. If sugar levels are a little higher than 140, we ask them to go for HbA1c test, which actually is the average blood sugar level for past 3 months. Now, if someone is at pre-diabetes stage, that can be taken care of by having a proper healthy lifestyle, managing that, like introducing exercise, eating healthy diet, taking less of stress. But in type 1 diabetes, there is nothing like, you can kind of reverse it, or in any kind of diabetes, for example, any kind of diabetes, it's the reversal is a wrong word. It can be remission, and remission also, I mean, is there's an eligibility criteria for that also, to come back to the normal ranges. And if someone is also, they have achieved that, they are still at a risk of getting type 2 diabetes. In type 1, it doesn't happen like that. You can early diagnose it, and maybe delay the progression of type 1 diabetes, but you cannot, do the remission or reversal, whatever, in any language. You cannot do that. You might delay the progression. So type 1 diabetes is not because of an unhealthy lifestyle. It is because of a trigger. Trigger, by that I mean any environmental factor, any virus that gets into our body. It manipulates our immune system, and the effect of that manipulation is our own immune system goes to the pancreas, and says to the pancreas, okay, kill insulin producing cells. And because of that manipulation, our own body starts killing the insulin producing cells, which we call beta cells. Okay, so over here, the term that we give to this whole manipulation is autoimmune disorder, right? So over here, we have a very thin line of difference between type 1 and type 2 diabetes, but it is very important. In type 1 diabetes, we we cannot we cannot have an alternate treatment. Insulin is the only treatment, and insulin can be delivered through several devices like Ashlesha presented. In type 2 diabetes, it's the insulin resistance. So body produces insulin, but it is not being used properly, just like a key and lock. Okay, so this key is defective. Even if I put it in the lock, it would take, like, a lot of time to open the lock. This is what is insulin resistance. And autoimmune, where no insulin is there, you can imagine that the key has been lost. We have the lock that is, on our in our body, but we don't have the key, insulin, in our body being produced. So what we do, we basically take a copy of our key. Copy of our key is the insulin injection, the insulin that we take from the injections. Okay, so this is, in a very simple language, type 1, type 2, and there are many other types. I'm not going in detail over there. But when I was diagnosed at the age of 4 in 1992, I mean, it wasn't like, anybody knew about this medical condition. But still, my school teachers and principals, they said, okay, it's fine, we will take care of that. Unfortunately, because of the misinformation around diabetes, because of lack of knowledge around type 1 diabetes, the schools are also denying admission to the children. Schools are not being supportive of children. I'm not talking about all the schools, but there are schools who are scared, and we understand the school's perspective also. So this is the way where schools can get engaged, can be, engaged in a very interactive activity. And school by school, I mean teachers, students, and everyone, and also learn about type 1 diabetes. I think this is why we need to educate everyone, And this is where the community also gets in. So as a patient support organization, Jyotsna is there, I am there. We advocate for the rights of people living with type 1 diabetes. Jyotsna, would you
Yeah.
like to add over here?
Yeah, also to add to that, coming back to the question that was asked, so just to make it clear, for type 1 diabetes, usually people get to know about it at a very late stage. It's not possible to diagnose it early. It is possible to diagnose type 2 diabetes, gestational diabetes, and few other types of diabetes early by a simple blood test. But since type 1 diabetes, usually young kids, young adults are affected by it, so it's impossible to find it out. Although there are 3 stages in type 1 diabetes as well, but usually it gets diagnosed in the last stage when suddenly the symptoms develop, and the person is usually in diabetes ketoacidosis in majority of the cases, which is a condition, which is a life-threatening condition. So that is why right now a lot of research is going on with respect to finding early diagnosis in type 1 diabetes as well, so that we can diagnose it in early stage, and so that the person doesn't land up into a decay and doesn't develop any other acute complications because of that. So that is something that is happening, and we really hope that happens soon. Yeah. And to answer your question, Ashlesha, why it is important, while we were there at the JDRF summit with Deccan and Saurabh, we realized, all of these problem statements we developed, when we were discussing about it, we realized how important all of these things are. These are the things that we live with every day. These are the common challenges that all of us face, no matter where we are living, what are our different backgrounds. And we understood that although there is a lot of research and innovation that is happening, but still we are far behind from what we want to achieve for everyone living with this condition, which is why we want these young kids brimming with ideas to come into the picture, share their solutions, share their innovative and creative ideas, which can help us to execute them. As communities, we like Mridula, there are many other communities within India who are working extensively for people living with diabetes, but we need more ideas, we need more solutions, so that we can take it to the next level. And that can only happen if we all come together as a community, and we all first understand what type 1 diabetes is. So I want to first know, like, how many people do we have on the call? I think around 14, 15 people. So how many of you already knew about type 1 diabetes before this call? So if you can just raise your hands, it will let us know. And how many of you got to know about today after Ashlesha gave that presentation? Okay, I think just one person, like that,
Yeah.
that is there. Like, the statistics is there. Like 2% of people only know in this call, and 98% don't know about type 1 diabetes. This is the state, and this is why we need this, to create awareness, to tell people about type 1 diabetes, and also which will help us to reduce the stigma, burden, blame, guilt that we all go through. Because every time we tell people that I have diabetes, they are like, "Arey, itni choti umar mein you are so young, how you can get diabetes?" And we want to come at a situation where people stop stigmatizing us, stop judging us, stop telling us what we should do and how we should live with this condition. And that can only happen when we educate, when we empower people, when we spread awareness, and that will just change the whole game. So I hope that answers.
So we have some questions from we have a question from Shruti ma'am and Sakshi ma'am. So let us give them chance to ask the questions.
Absolutely.
Yes.
So I request Shruti ma'am to just go ahead and ask the question.
Hello.
Hello.
Yes.
Good evening, ma'am. I have gone through your things. It was nice to interact with you all. Regarding this thing, type 1 diabetes, like you all have mentioned, what students can do project, posters, videos, brochures, like even apps also they have put. I just wanted to know whether students can include how to in the whether they're making PPT or video. Is it can they add importance of medication or maintaining that diet to it?
With respect to type 1 diabetes, we do not have any medication as such. So insulin is the only kind of a treatment for type 1 diabetes. So I think there's a question on this in the chat as well. So for type 1 diabetes specifically, we do not have any pills or medication. So insulin is something which there is no substitute for that. We have to take insulin from outside, either through a syringe, either through an insulin pen, or either through an insulin pump. So it's
I
very
think management.
Yeah.
Yeah, sorry. Just I think Jyotsna, what she's trying to I think ask is how, like, if we can, work around managing the medication like insulin, like, Deacon also mentioned about cooling packs and all that stuff. I think is that what you were asking, Shruti ma'am?
Yeah, because students, the people also has to know aware of it. No, so can they add this thing to whatever like Mridula ma'am has told?
Okay, so Deacon, I think Deacon would be uh, in a better position to answer, or Saurabh.
Sure, they can. It's up to the students how they understand the type 1 diabetics and come up with the solution. So
Yes,
you
we
can
need to kind
actually
of
guide them on it.
specify. Yeah, we need to kind of specify the medication in that particular
You're
problem,
right.
because people might not know what kind of medication is required for type 1 diabetes.
Okay, thank you, ma'am.
No, I got lost in a second because I took off my headphones. So what was the question again?
So the question was,
Uh,
she was saying that there was a particular problem statement, and it's regarding the medications. So how would the children know what kind of medications the type 1 diabetes use, because we don't use any pills or anything. So we kind of have to specify there.
Okay. So yeah, that's a good question actually. But fair enough. We can do that.
I think
In
awareness around insulin
Mhm.
and management of insulin. I think all of that can be covered. Yes,
Hmm.
I mean it has to be, because students are not, biased, and they're not kind of bound with all these knowledge and kind of inputs around diabetes. So they have a very free mind, so as broad as wild they can think around, taking the message to the people. So I think it could be whatever they feel can take up the message to the mass. So yeah.
Yeah.
Okay, thank you.
So
So
yeah. Are there any more questions? No.
Yes, I think Shreyas
No.
and Sakshi also has raised.
So
Good evening. I'm audible.
Yes,
yeah,
you're
yeah.
on.
Uh, Actually, I wanted to ask that, like we know that type 1 is active, especially in children. So, like for a prolonged period, when it stays with the child, and as the child grows, does the parameters change at any level? Means for standard of living or related to insulin dose. So taking or living with the diabetes, like we have a guest who is actually with the same disease. So does it change after certain
Yeah.
age, like after gaining adulthood or anything of that?
Yeah. So very, I mean, great question. And so basically, insulin is nothing but a growth hormone. And as we grow, especially in the adolescence, and the transition from childhood to the adolescence stage, the requirement of insulin increases. And because that is the time where hormones are changing, where there would be change in the voice, there'll be growth of body hair, and so there'll be several changes. Menstruation in young girls would be there. So that time is when especially insulin requirement increases, and with age it can become like at a stage, around when you you grow up, you're adult around 20s and all, your insulin doses will come to like kind of, very slowly, gradually they might increase and become constant then. So it's not like uh, it's going to definitely increase with like huge numbers with the growing age. It's definitely going to increase at adolescence age. That would be the like a huge leap, but gradually it's going to be like kind of slow down and become kind of constant. But of course it also depends upon the way it is being managed. Of course, if a person is not managing it well, the sugar levels are going to fluctuate and the insulin doses would keep on increasing.
Also,
So
Shreyas,
proper education over here is very important.
also, Shreyas, it's important to understand that there are many factors that affect your blood sugar. It's not just food, but it could be stress, it could be exercise, it could be how much water you're drinking, it could be pregnancy, it could be periods, and a lot of different. So there are like hundreds of factors that affect your diabetes, and it affects at different stages at a different time. So, and even if like I am, for example, if I am living with this condition and these are the factors that affect me, it's not necessarily that that will affect Mridula. So we all have different bodies, and insulin reacts differently with our bodies and the different activities that we do on a day-to-day basis. So it's a very kind of a personalized thing, and you can only ace it through a trial and error. So definitely your insulin requirements and parameters changes at different stages of life.
Also, there is very important point to note over here. If someone is taking insulin, doesn't mean that that person has type 1 diabetes only. So that person can also have type 2 diabetes and is on insulin. So it's you have to basically understand that you have to ask them if they know about their medical condition. Mostly like grandparents or elderly people, even middle-aged people might also be taking insulin, but it depends. There are different types, and treatment could be insulin for different types. Yeah.
Thank you, Mridula.
Hope your question is answered.
Any more
Yes, ma'am.
questions?
Thanks.
I
Do
think
we have any
Shruti has a
questions
question.
related to the hackathon?
Any questions related to the hackathon from teachers? Okay. Great. So Shruti has a question. Saurabh, does Shruti have a question? Do you want to ask the question, Shruti?
Sir, may I
It's already
may
over.
I ask a question?
Yeah, please.
Uh, can you tell us about the basic difference between type 1 and type 2 diabetes, and how can we easily get to know, or we can introduce it कि मतलब हम कैसे पहचान सकते हैं easily कि whether it is type 1 or type 2, or whether the person is having diabetes or not?
तो जैसे मैंने बताया था आपको, मैं हिंदी में एक बार बताती हूँ सबको। टाइप 1 डायबिटीज और टाइप 2 डायबिटीज का हम एक ताले और चाबी की तरह से एक एग्जांपल लेकर चलते हैं। अगर ताला है हमारे पास हमारी बॉडी के अंदर, और हमारी इंसुलिन जो है एक चाबी चाबी है, और जो ताला है बेसिकली आपके जो सेल्स होते हैं, हमारी बॉडी सेल्स से बनी हुई होती है, मल्टीपल सेल्स। तो उसके ऊपर एक जो है एक ऐसा पार्ट होता है जहाँ पे ये इंसुलिन जाके लगती है, और हमारा जो ग्लूकोज जो हमारे ब्लड में फ्लो कर रहा होता है वो एंटर कर सकता है। तो ताले चाबी की तरह ये हो गया। अब आपका ये ताला है अगर, और आपकी ये जो चाबी है ये खो गई है, तो अब क्या करेंगे? इंसुलिन यानी कि शरीर में नहीं बन रही है, तो कहीं से तो चाहिए होगी हमें, वरना जो हमारे ब्लड में जो हमारा ग्लूकोज फ्लो कर रहा है वो सेल्स के अंदर नहीं जा पाएगा। तो इसके लिए हम एक डुप्लीकेट चाबी बनवाते हैं। डुप्लीकेट चाबी खोलेगी ताले को। अब वो डुप्लीकेट चाबी क्या है? हमारे इंसुलिन जो हमारी वाइल में कार्ट्रिजेस में आती है, जो बाहर मार्केट से हम खरीदते हैं, और उसको हम खा नहीं सकते, उसको हम पी नहीं सकते, हमें उसे इंजेक्ट करना पड़ता है। ये हुआ हमारा टाइप 1 डायबिटीज। हमारे शरीर में जब कोई वायरस हो या कोई भी ऐसा एक ट्रिगर हो, आज तक पता नहीं चला है एग्जैक्ट कि क्या है वो ट्रिगर, पर जब भी कोई ऐसा वायरस या कोई भी इन्वायरमेंटल फैक्टर हमारी बॉडी में एंटर करता है, वो हमारे इम्यून सिस्टम को, इम्यून सिस्टम मतलब जो हमारा अंदर बॉडी में जो लड़ाई करते हैं सेल्स बाहर के बीमारी से, उसे हम इम्यून सिस्टम कहते हैं। अब वो इम्यून सिस्टम को बाहर का वायरस आके बोल देता है कि जो है तुम जो है जाकर अपने जो पेनक्रियास के जो इंसुलिन बनाने वाले सेल्स है उन्हें मार दो, मैनिपुलेट कर देता है। और वो उसकी वजह से हमारा खुद का इम्यून सिस्टम वो सेल्स को मार देता है, इंसुलिन नहीं प्रोड्यूस हो पाती। ये है हमारा टाइप 1 डायबिटीज। बट टाइप 2 डायबिटीज में क्या है? टाइप 2 डायबिटीज में फिर से हम वही ताला लेकर आते हैं। अब ताला तो यहाँ पे ले आए, तो ये जो गड़बड़ हो रही है कि चाबी जो है आपके अंदर जा रही है, वो वहां पर वो ठीक से काम नहीं कर पा रही है। यहाँ पे गड़बड़ हो रही है कि ये खुल ही नहीं पा रहा है ये ताला। तो है तो सही, इंसुलिन तो बन रही है अंदर, आपकी बॉडी में इंसुलिन बन रही है, पर वो ताले को ओपन नहीं कर पा रही है। तो इस केस में हमारे टाइप 2 डायबिटीज कहते हैं, यानी कि इंसुलिन रेजिस्टेंस। आपका इंसुलिन को रेजिस्टेंस मिलता है बॉडी से। इसके लिए हम ओरल पिल्स भी ले सकते हैं, जैसे कि दवाई होती है आपकी मेटफॉर्मिन, एक बहुत कॉमन दवाई है ना। और इसके साथ हो सकता है कि किसी किसी को टाइप 2 डायबिटीज में इंसुलिन इंजेक्शन भी दे, क्योंकि उनका उस मेडिसिन से कंट्रोल नहीं हो पा रहा है। टाइप 2 डायबिटीज मोस्ट ऑफ द टाइम आपकी लाइफस्टाइल के प्रॉब्लम की वजह से होता है। आपका मोटापा ज्यादा हो गया, स्ट्रेस हो गया, या फिर आपके जो है एक्सरसाइज नहीं होती है, पूरे टाइम बैठे रहते हैं, खाने पीने का कोई अता पता नहीं है। और एक और बहुत इंपॉर्टेंट चीज इन दोनों में क्या है कि हेरिडिटरी। टाइप 2 डायबिटीज कैन बी इनहेरिटेड, आपकी फैमिली में वो रन करती है और रिस्क होता है। ऐसा नहीं है कि अगर किसी को टाइप 2 डायबिटीज है पेरेंट्स को, तो उनके बच्चे को डेफिनेटली होगी ही होगी, पर वो उनका बच्चा बहुत हाई रिस्क पे होता है टाइप 2 डायबिटीज के। टाइप 1 में क्या होता है? टाइप 1 में जेनेटिक है, हेरिडिटरी नहीं, जेनेटिक। जेनेटिक मतलब आपके जो है कुछ ऐसे क्रोमोसोम्स होते हैं, क्रोमोसोम्स भी मैं बहुत थोड़ा डिफिकल्ट वर्ड हो जाएगा, बट आपके जेनेटिक लेवल पे अंदर जो है वो मैनिपुलेट हो जाता है ना। और वहां पे मैनिपुलेशन की वजह से, वो चेंजेस की वजह से आपके जो है यहाँ पर ऑटो इम्यून प्रॉब्लम्स आती हैं। हाँ, ये जरूर है कि जब एक विमेन को टाइप 1 डायबिटीज हो पर उनके पार्टनर को नहीं है, तो अराउंड 2 to 3% चांसेस होते हैं कि उनके बच्चे में हो सकती है। अगर अगर मेल को है, मेन को है, पर विमेन को नहीं है, तो उसके और थोड़े परसेंट चांसेस बढ़ जाते हैं, अराउंड आई थिंक 5% के अराउंड है। बट अगर हस्बैंड और वाइफ दोनों को है टाइप 1 डायबिटीज, तो देयर आर मतलब मल्टीपल चांसेस कि आपके टाइप 1 डायबिटीज बच्चे में भी आएगी। तो यहाँ पे हमें ध्यान देना है कि इट्स मोर ऑफ जेनेटिक टाइप 1 में, और हेरिडिटरी यानी कि फैमिली में रन करना वो आपका टाइप 2 डायबिटीज का होता है। ज्योत्सना अगर कुछ ऐड करना चाहो तो।
आई ऐड टू दैट, जैसे मृदुला ने बहुत अच्छे से समझाया, लेकिन आपने पूछा कि आप कैसे आइडेंटिफाई कर पाए कि वो टाइप 1 है टाइप 2 है। तो टाइप 1 यूजुअली बच्चों को होता है, बट आजकल ये अडल्ट को भी होने लग गया है। लेकिन अगर बच्चे को ये 4 मेन सिम्टम्स हैं, जिसको हम बोलते हैं 4 T's ऑफ डायबिटीज, विच इज टायर्ड, आपका बच्चा बहुत थकने लगा है। थिनर, आपके बच्चे ने अचानक से बहुत वेट लूज कर लिया है, बहुत पतला हो गया है, हड्डियां दिखने लग गई है। थर्स्टी, उसको बहुत प्यास लग रही है। एंड टॉयलेट, कि वो बार बार वॉशरूम जा रहा है। तो ये 4 T's आर द मेन सिम्टम्स टू आइडेंटिफाई इफ अ पर्सन हैज टाइप 1 डायबिटीज। अगर आपको किसी भी बच्चे में ये 4 T's, ये 4 सिम्टम दिखते हैं, उसको इमीडिएटली डॉक्टर के पास लेके जाना है और उसका डायबिटीज का टेस्ट कराना है। ठीक है, तो ये एक आइडेंटिफायर मार्कर है बिटवीन टाइप 1 एंड टाइप 2। एंड अगर किसी अडल्ट को हुआ है, अगर आप कंफ्यूज हैं कि वो टाइप 2 है या टाइप 1 है, तो एक गैड एंटीबॉडी टेस्ट होता है जो हॉस्पिटल्स में अवेलेबल होता है। तो उस टेस्ट के थ्रू वो आइडेंटिफाई कर सकते हैं कि वेदर इट इज टाइप 1 और टाइप 2. So that is possible to identify. But if it is a kid, then you can easily identify through these symptoms.
टाइप 2 डायबिटीज बच्चों में भी पाई जाने लग गई है।
हाँ.
और ये लाइफस्टाइल की वजह से है। तो अगर आपको सबसे सिंपल है टाइप 2 डायबिटीज में, तो कुछ टेस्ट भी नहीं करना है ब्लड का। सिंपल गर्दन के पीछे देखिएगा, अगर काली काली आपको लाइंस दिखाई दे, है ना, यहाँ पे गले के पास आपको काला काला ऐसे तिल जैसा दिखाई दे ज्यादा, और ब्लैक आपके पीछे गर्दन हो, ये टाइप 2 यानी कि इंसुलिन रेजिस्टेंस के सिम्टम्स होते हैं। टाइप 1 डायबिटीज में भी आप अगर सिंपल प्रिक टेस्ट भी करते हो ना घर पर, सिंपल प्रिक टेस्ट करते हो, अगर शुगर गड़बड़ आ रही है तो आप पता कर सकते हो। you can understand very well understand that sugar levels are not in the target and you need to take action on it.
But I think हमारा फर्ज है like as कि just test your blood sugar. कहीं पे भी फ्री ब्लड कैंप लगा है, फ्री शुगर टेस्ट लगा है, just go and test it. It doesn't, इससे कुछ फर्क नहीं पड़ता। ठीक है, जितना जल्दी पता चल रहा है उतना बेटर है। और बच्चों को भी टेस्ट कराएं। आप ये मत सोचिए कि ये तो बच्चा है, इसको डायबिटीज थोड़ी हो सकती है। नाउ यू नो कि बच्चों को भी हो सकती है, इसलिए आप साल में एक बार जरूर अपना टेस्ट कराएं। और अगर आपको लगता है कि आपकी ब्लड शुगर नॉर्मल रेंज से ऊपर है, तो आप डॉक्टर से जरूर कंसल्ट करें, ताकि वो आपको डायग्नोस करके ठीक से ट्रीटमेंट दे पाए।
डॉक्टर का मतलब आप प्लीज समझ लें, डॉक्टर का मतलब सिर्फ आपका एंडोक्रिनोलॉजिस्ट और डायबिटोलॉजिस्ट को ही, स्पेशलिस्ट को दिखाएं। जनरल फिजिशियन को भी जा सकते हैं आप, बट आप स्पेशलिस्ट के पास जब जाते हैं, आपको यू अंडरस्टैंड द टाइप ऑफ डायबिटीज यू हैव। सो फॉर एग्जांपल, ज्योत्सना सेड गैड एंटीबॉडी टेस्ट, आई एम गैड नेगेटिव, I do not represent those antibodies. So it is better that the doctor decides, taking into consideration every single thing and your blood sugar levels, and then decide on what type of diabetes do they have. Okay, yeah.
I hope your
Thank you
questions
so
are
much, ma'am.
answered.
Thank you, Jyotsna, ma'am. Thank you, Mridula, ma'am.
Thank you. Just a small reminder, there's a link shared in the chat box. Please fill it up, the form. It's been posted by Saurabh. And a last question to you guys. What do you think is the role of community, and how have your communities, respective communities, helped people living with diabetes in India, be it school-going kids, teachers, or working adults or teenagers?
I think I'll keep it short. I know we have already over 15 minutes, but I say as role of communities is very important, because 10 years back, 20 years back, people were, they felt completely alone with this condition. They only had, their parents or doctors' support with respect to managing their condition. Only when these communities started to form, people started to meet others whom they can relate to, who very well understand about their condition, about their challenges, or everything that we go through on a daily basis. So it gave them a lot of confidence, and it gave them a lot of motivation to live with their condition nicely, and also, to tackle this all of these challenges together as a one group. And unity is always something that works best in all areas, and why not type 1 diabetes. So this, which is why different communities started forming. And very fortunate that today there are so many communities within India, like Mridula's Diabetes Fighter Trust. Like I'm running Diabetes India Youth in Action, DIA NGO in Delhi. And what we're trying to do is we're trying to bring people together and also their parents together, because they feel alone when they are diagnosed with the condition. Right now, healthcare is so overburdened that they do not provide the emotional support that they need at the time of diagnosis. It's a very big thing to accept. And all of us have faced all of these issues. Like Mridula was diagnosed when she was 4. I was diagnosed when I was 21. But I think both of us felt the same, although we were at different ages. But we felt alone. Like for 2 years, I felt like there is no one else like me. And, I felt very alone. I felt I was kind of in depression. Only when I started meeting people, it really gave me so much of confidence, so much of happiness by connecting with people. And I think the role of communities is to bridge the gap between doctors and patients who are living with this condition, so that doctors who are not able to provide more information, education, and awareness, we can bridge that gap, and communities can come forward. They can provide education. They can tell people about type 1 diabetes, how they can live with this condition, how they can manage it well, and how they can also take care of the mental aspect of this condition, and not just taking care of the numbers, because it is an emotionally and mentally draining condition. We live with it 24/7, 365 days, and there is no break at all. So it's important that we take care of our mental health, and we also not let it overpower us, because it doesn't define us, and all of us are living examples that we are doing exceptionally well in our lives, not just through this community, but beyond that as well. And that's the kind of message and example that we want to set for people. And also I would like
Wonderful.
Yeah.
Wonderful, Jyotsna. And I think what she said, acceptance. Just imagine a 4-year-old child or anyone. I mean, especially children we are talking about, because you are coming from school background. Just imagine a 4-year-old child or a 2-year-old child being injected 4 to 5 times in a day throughout their lives. Imagine that child pricking their little cute fingers before and after every single meal that they eat, and and you know feeling that why me, or why my child is going through this rough time. What went wrong? What did I do that took my child into this difficult phase? So empathy, एक दूसरे को समझना और एक दूसरे के साथ शेयर करना, कई बार बात करने से ही बहुत सारी प्रॉब्लम्स सॉल्व हो जाती है। एक कोई होना चाहिए कि हाँ, ये मेरी बात समझ सकता है, क्योंकि ये मेरे को मेरे मेरे जिस दौर से मैं गुजर रही हूँ, या जिस फेज से मैं गुजर रही हूँ, वो एग्जैक्टली वो समझ पाएंगे, वो फील कर पाएंगे। आप किसी बाहर वाले को बोलोगे, शायद वो सिंपैथी दिखा सकते हैं, बट एम्पैथी नहीं दिखा सकते हैं, और इन दोनों में बहुत डिफरेंस होता है। एम्पैथी अगर किसी और को, बाहर वाले को दिखानी है, तो उन्हें समझना पड़ेगा कि ये पूरा प्रोसेस होता क्या है। इसीलिए कम्युनिटीज एक साथ मिलकर जो काम कर सकती हैं, मतलब एक डंडी होगी आप आराम से तोड़ दोगे, पर एक पूरा बंच होगा स्टिक्स का, यू कैन नॉट ब्रेक देम। एंड इसी तरीके से कम्युनिटी एक साथ आती है, अगर उन्हें कोई तकलीफ है, वो गवर्नमेंट से कुछ मांगना चाहती है, तो कम्युनिटी एक साथ आती है, वो रोल होता है कम्युनिटी का। अगर वो कोई महंगी चीज है डायबिटीज को मैनेज करने के लिए, और वो चाहते हैं कि उसे सस्ते में मिले, तो शायद वो एक साथ मिलकर उस चीज के लिए एडवोकेट कर सकते हैं, या उसे बल्क में खरीद सकते हैं। तो ये सारी चीजें हैं जो कम्युनिटीज एक साथ करती हैं अभी एट प्रेजेंट, बट इनको साथ में मिलकर और इनके साथ इनोवेशन करने में आई थिंक हम और आगे जा सकते हैं, जो शायद चीजें बाहर के देशों में अवेलेबल है पर अपनी कंट्री में नहीं है। वो चीजें हम कम्युनिटी के साथ मिलकर, क्योंकि आप कोई भी इनोवेशन करोगे वो आपकी थॉट है, पर क्या कम्युनिटी को वो चाहिए या नहीं, आपको वो वैलिडेट करना पड़ेगा ना आइडिया। कि हाँ मैंने ये चीज बनाई है, क्या आप ये यूज करोगे? वो बोलते हैं कम्युनिटी की हाँ ये तो बहुत अच्छी चीज है, ये मेरे लिए बहुत काम की चीज है और मैं यूज कर सकती हूँ. Then you come back and create that innovation from idea to a product. So yeah.
Yes, very beautifully explained, guys. Thank you so much. Deacon, would you like to give the vote of thanks?
Yes. Thank you so much to both of you for coming on this call. I think it's made a big difference in the minds of people. I can see the chats also. A lot of people are now empathizing. And so, more than empathy, what we want is people to participate. We want kids to be part of this awareness campaign. And the bigger picture here is, as Mithila said, we don't want to stop here at school children. I think the school children will form the base of this perpetual hackathon that we'll be driving. So the plan is obviously to have a children hackathon followed by a students hackathon for college students. Then we get into the startup space and we'll focus on companies in the medical fields. People who can actually make a difference using our ideas that have come up from the grassroots level. And when I talk about grassroots, I'm talking about the school children. So I want all of the teachers on this call, to understand that whatever you do, whatever small impact you make over here, will have a broader recall, maybe a year down the line. Hence, when an idea which was taken from here as a top 3 winning idea becomes an implementable solution 2 years down the line, and that's when you will feel proud and you have made a difference. And I want to again re-stress on the fact that school is the first community that we have. We want you. We know that the children trust you, love you, the parents look up to you. You are the community builders for us. So while we will support you with whatever information, knowledge we have, Jyotsna, Medula, me, Saurabh, Ashlesha, all of us. In fact, there's a big group of us. And in fact, Jyotsna and Medula are part of this group called the Impatient Network. So we will be introducing the Impatient Network to this hackathon over phases. In fact, Jyotsna, Mridula, and others will also be the mentors for the various teams who will take part. So you will get to see a lot more of these girls over the next 3 months. I can promise you that. But yes, school is community, and that's what we want. So thank you so much for coming on this call today. We had a less than spectacular turnout. Usually I foresee turnouts are usually 40, 50 plus, but I'll take what we can get because I know it's a social cause, but we will build up from here. Please do spread the word, teachers, to all your friends in different schools as well. We will be sending invites for the next webinar, so do ask your friends to take part as well. We would love to see more participation from your peers and colleagues. Thank you so
I
much,
think,
everybody.
yeah, Deacon, I just wanted to say something. I mean, maybe these could be the students who represent their schools at Shark Tank also.
They could be, right? They could be the schools. Yeah, they could be the schools. They could be the teachers who are
Yes.
proudly saying that that kid I know is raised $1 billion. Yeah, so you never know. So great. Looking forward to your support. Thank you so much, everybody. Thanks, girls. Thank you so much. Thanks,
Thank you
Ashlesha.
so much.
Thanks,
Yes.
Saurabh.
Thank you. Bye.
Thank
Thank
you.
Yeah, bye.
Yes.
Bye.
Bye.
Thank you all. Stay tuned for
Thank
the
you.
next webinar.